Alrighty. So today, so basically, this is me simply re-recording a recording. Uh, क्योंकि I know Naveed bhai is gonna join in any second now, and we're gonna start off with the new stuff. So I wanna review the old stuff. So I'm gonna review it in the mirror with myself, and I'm gonna record myself doing it. So here we go, Bismillah. So this is what we did yesterday, which is the stick show for pathology. And we started off with the very basics of it all. Um, and that was you have multiple types of inheritance. Now, what are those multiple types of inheritance? There are six types. The first
Autos-
one,
Autosomal dominant,
awesome,
autosomal recessive, X-linked, mitochondrial, and that HLA thingy, additive.
additive,
Yeah.
awesome. And then finally, the addition of the combination of above. All right. So there can be many examples. So for autosomal dominant, we all know Huntington's. For autosomal recessive, we all know that's cystic fibrosis. And we know a few more like X-linked diseases, which can be color blindness. For according to this, which is the muscular dystrophy. For mitochondrial, there's Leber optic atrophy, and for additive, it's the HLA class 1 in
Uh,
HLA class 1
HL
in
class one and yeah, uh,
multiple.
sclerosis.
Awesome. And this was the night something. Sorry. Yeah. Non-syndromic deafness. Okay. Awesome. Say. Let's talk about cytogenic disorders. There are two types of cytogenic disorders. There are one which involve the autosome, and there are ones which involve the sex chromosome. ऑटोजोम्स के अंदर हमारे पास तीन किस्म की ट्राइजोमी है. तो we have Mr. Numer joining us live. Can you tell me what's trisomy 18?
Edwards.
Awesome. Naveed bhai, what's
कोई
trisomy
है ही नहीं बीच में.
13?
Uh, Trisomy 13, Patau.
Yay. Okay, what is a type of deletion syndrome?
Um, Deletion. Um, can't recall.
Yeah, so it's the khair hai, koi masla nahi. Chromosome 22q something, yeah? Yeah, 22q11.2, Allah maaf kare. Deletion syndrome. Maybe remembering this just as deletion syndrome would be good enough. And trisomy 21 is Down syndrome. Then we have two diseases mentioned in the slides, which involve sex chromosomes, which is Klinefelter's and Turner's syndrome. Okay, now to the most important part, the textbook definition of pathology. Pathology is the study of the structural, biochemical, and functional changes in what?
Um, in cells and organs.
Okay, great. And what do they underlie?
Um,
They
Underlie.
underlie disease. All right. So
Uh,
I'll repeat the definition. Pathology is the study of structural, biochemical, and functional changes in cells, tissues, and organs that underlie disease. Okay. Awesome. Say Now to we are moving on to the core of pathology. There are four main steps of deducing or diagnosing a patient, which starts off with your etiology. Now, what is etiology? Etiology is the cause. What caused the disease? Numer bhai, what's next?
The manifestation of the disease that specified whether it was what kind of bacteria it was, what kind of virus it was.
Beautiful. What's the word?
Um, what was it? I
Starts with
never
a
remember
P.
I never remember the second one.
Starts with a P.
Pathogenesis.
Ends with an
Yes.
S.
Yes.
Did someone say it?
Yeah, मैंने बोला pathogenesis.
Oh, thank you so much. Pathogenesis. Awesome. I need to I'm concerned when you mentioned you don't know the second one. Like you never remember the second one. I'll scold you over that someday. Here, the third
That's
is
morphological changes.
morphological changes. Now, what are those? Uh,
The
those
changes
are
that bacteria make in the cells and organs.
exactly how the body, what structural organization of the body, Miss Rahma?
Structure organization of the body.
Yeah, what part of the structural organization of the body would react?
The cells
Awesome. And
and tissues and organs and whatever is getting affected.
yay, exactly. Awesome. And finally, we have what the doctor sees, which is the clinical manifestations, right? Awesome. So that is the core of pathology. Next up is what we discussed yesterday about how a cell can have multiple types of injuries. It can have a reversible injury and it can have a irreversible injury, right? And that's the point. When the cell is inflicted upon with stress or an injurious stimuli, it would adapt to it, and that would lead to reversible cell injury. Okay? I hope that makes sense. So this is the total basic of pathology. Next up are the definitions. So I'll go to the slides where we annotated the definitions. Or I don't think we did that. Oh yeah, we did. We did. We did. Yeah. So we just went through them. So I'll go through them again. कोई मसला नहीं. Hypertrophy refers to an increase in size in the cell that results in an increase in size of the affected organ. What would be an example of hypertrophy, Numair bhai? Radio silence.
Can
What
you repeat
about
this again?
mamrama? Example of
The
hypertrophy.
is it the muscles?
Awesome.
Hmm.
Can you specify which muscle?
Deltoid, I think.
Yeah, it can
Too
be deltoid.
specific, but awesome. So,
Yeah, but I
Triceps
just
brachii.
shared a table. I just shared
Yep,
a table if you want to take a quick
deltoid
look at
and
it.
uterus.
Naveed bhai, can you repeat?
I said I just shared a table on WhatsApp. If you wanna,
Hey, Naveed, are you showing articles again?
no,
Oh,
there are
okay.
only
So this
two
is type
references.
of chromosomal abnormalities. Okay, I'll just get this on the iPad. Wait. Okay. Awesome. So, types of chromosomal abnormalities, how they happen, and what are their diseases. So, trisomy, three copies of a chromosome, three types: Down syndrome, Edwards syndrome, and Patau syndrome. And then we have monosomy. which is having only one copy of a chromosome, and the only type of disease that we know is Turner's syndrome, which is monosomy X. Okay, let's move on to structural abnormalities. We have deletions, duplications, translocations, and ring chromosomes and isochromosomes. So for deletions, it simply means what it says, it's a loss of a chromosomal segment. An example would be the Cry-do-chat syndrome, which is the deletion in chromosome 5, and the other syndrome, which is deletion in chromosome 4. Okay. Then we have duplications, which is gaining a copy of a chromosomal segment. It varies depending on the duplicated genes. Okay. Then we have translocations, which is the reattachment of chromosomal segments. And this basically can be either balanced or unbalanced. So, what would be a balanced translocation?
Where the exchange is even.
Awesome. So, I'll show you that picture which was in the slides. Yeah. So, I hope by looking at this, it makes sense. All good?
Okay.
Yes.
So yeah. So if you go back to that table, open the new table that I just sent. I added more things in it. Do you know there is a disease called a cat eye disease, cat eye syndrome?
I had no idea.
So the pupil is more like a cat eye, like an elongated pupil.
Wow, that is scary. So, lizard people have them.
I guess.
Okay.
Duplication of chromosome 22.
Wow. This is scary to look at in the photos.
Yeah.
Yeah.
ओके पीछे भी
Okay.
ऊपर भी स्ट्रक्चरल उसमें भी कुछ चेंज वो थी नई डिजीजेस हैं सो ट्रिपल
Oh, the
एक्स
superwoman syndrome, right?
क्लाइन
Yeah.
या
Okay.
Klinefelter syndrome and then XO syndrome, complete absence of X chromosome.
Hmm. Okay. Translocations, as we mentioned, they could be either, you could say, balanced or disbalanced. Ring chromosomes have end of a chromosome fuse forming a ring, and we usually have ring chromosome 13 or ring chromosome 18 syndrome. And isochromosomes are duplication of one chromosome arm which miss the other one. So that's about it. All good?
Okay, thank you.
Awesome. So I believe the definitions should be good enough, right? Like we all know what metaplasia is, right? Can anyone tell me what metaplasia is?
Yes, sir. Change of cell type
What causes it?
could be external or internal um, things.
Irritation.
Yeah, smoking causing a change um, in the no, not esophagus. The what is the trachea on the conducting parts of the cell. That's pathological, and similarly increased stress on heart muscles, leading to heart muscle atrophy. Not atrophy. The changes in the muscle type.
Most common is squamous to
Uh,
columnar.
no, no,
Oh, sorry.
columnar to squamous.
Oh, columnar to squamous. Thank you.
See, see, I'm awake. I know you were checking if I was awake.
No, no, I messed up. I'll admit to that. I don't want to take the credit. More columnar to squamous. Besides, I'm recording this, so don't want anyone to feel otherwise. Here, atrophy, reduction in the size of the organ, and which is due to the decrease in cell size and number. So totally opposite to hypertrophy and hyperplasia. Awesome. So this was the basic definitions. After that, we started to discuss hypoxia. And what hypoxia covered was everything related to cell injury. Just cell injury, not cell death, okay? Just cell injury. So we'll start again. Let's try to go through this quickly and in a way that, like, for example, Ma'am Rama is joining for the first time. I hope she understands it. So let's begin. Hypoxia. What is hypoxia? Hypoxia is the lack of oxygen supply to the cells. Okay? Lack of oxygen supply to the cells. Now, what would that cause is the question. कोई भी चीज नहीं है उसकी वजह से मुश्किल होगी उसकी कमी महसूस होगी. So having less oxygen would lead to less ATP production because oxygen is the final acceptor in the electron transport chain. You need it for ATP production. So when less ATP is produced, Ma'am Rama, can you tell me what type of respiration would take place?
Anaerobic respiration.
Yay. And what's the
Mm.
product for anaerobic respiration aside from
Lactic
pyruvate?
acid. Lactic.
Yay. So lactic acid is an acid. An acid decreases the pH. And when pH decreases, that means you're altering the normal state of the cell. And when you do that, the cell feels bad and it denatures the proteins and also causes muscle cramps. Okay? That's one aspect of having less ATP, this portion. I hope it was clear. The next portion is the transport pumps getting affected. We all know that transport pump requires energy for their function. Can you tell me the most important transport pump in our body?
Sodium potassium.
Yay. When that gets affected, many things start to happen. The most sad thing which starts to happen is sodium going inside, right? Sodium going inside. What's the one thing that will follow sodium?
You
Wow.
should water.
Yeah, I know. I should have added double tape. Water moves inside, right? And water is like, sodium itself won't do anything. It's just okay. Sodium is having a good time. Water comes in, water is the big boss. Water is going to destroy everything it touches. What water does is cellular swelling. And now cellular swelling does multiple things. The first thing that it does is make the rough endoplasmic reticulum swell. When the rough endoplasmic reticulum swells, the ribosomes detach, right? And when the ribosomes detach, tell me, what would happen?
The smooth endoplasmic reticulum would no, excuse me, the rough endoplasmic reticulum would no longer be rough endoplasmic reticulum. It loses its functionality.
Exactly. So it would have no protein synthesis. That's one aspect. What else? Have you heard of the microvilli? The
Yes,
microvilli are
ma'am. Yes.
small extensions and they are very useful for absorption. But what if the microvilli swell? When the microvilli swell, their surface area decreases, and because of that, they are not able to absorb anymore. So their function also gets disrupted. Another connection would be the cytoplasmic blebs formation, right? So random blebs form on the cell membrane. A bleb is basically like a bubble of water on the side of the membrane. And that causes irreparable damage. How so? Because it messes up with the permeability of the cell membrane. All right. So, so far, is this sticking?
Yes,
Yes,
CGO.
yes, CGO, yeah.
Awesome. Okay. That's the damage caused by the cell. What's next? We're going to talk about the most important ion which affects everything. It's called the calcium ion, right? Now, calcium ion influx does multiple things. It activates hydrolytic enzymes. Now, Numair bhai, can you give me examples of hydrolytic enzymes?
Mm, hydrolytic enzymes, no.
No?
Is it
What do you
hydrolysis?
mean? Yeah,
Go ahead. Go ahead, I'm waiting.
Hey, is it hydrolysis?
It is, yeah. Any other
Lipase,
examples?
protease, nuclease.
Yay. Right? So all of these enzymes, hydrolytic enzyme, proteases, lipases, phospholipases, and endonucleases, where's that mentioned? कहीं लिखा हुआ होगा, खैर. So what do? They basically disrupt everything in the cell. They destroy whatever is in their path. That's what the calcium influx does. What it also does is mess up with the mitochondrial membrane. And this is the most important point. It messes up with the mitochondrial membrane, makes it more permeable. And now, if you remember the mitochondrial membrane, it had a lot of proteins in it, embedded in it. Those were the electron transport chain proteins. And what would happen when they leave? They would trigger apoptosis. All right. So this was the chart which I discussed yesterday. It's a bit of a stretch, but it covers everything related to cell injury. So the examiner can ask anything from this. So for example, in one of the questions of the Viva, it asked about what cellular swelling does. So you should know what the cellular swelling does. All good?
yes.
Yes.
Awesome.
Yes.
So we're almost done. Now we need to go ahead with the rather memory-based part, which is the types of cell injury. Fatty change is a type of cell injury. It's a reversible cell injury, and it's only seen in systems that heavily metabolize fatty acids. Now, what are those systems, you may ask? That's the liver, the heart, and the skeletal muscles. अब fatty chain से होता क्या है? It basically means that lipid vacuoles appear in the cytoplasm. That's about it. So have a look at this. I'll tape this off and then I'll test you. Okay, I'll come back to this. We have reversible cell injury. That is the mitochondrial swelling. Okay, as we discussed above. But what about irreversible cell injury? Those are of two types, which we discussed, which was apoptosis and necrosis. Now, necrosis is, you would say, the more important one out of the two, which causes membrane damage. And because of that, the contents of the cell membrane, sorry, the cytoplasm leak out. And this is the main cause of inflammation. Now, this example will obviously be discussed in the blood module. So just remember, there's no explanation to it now कि ये कैसे inflammation cause करता है, but inshallah in the blood module we learn about it. So yeah, that's about it. So this is necrosis. We'll discuss more about it later. So can anyone tell me what is fatty change? And where does it happen?
Heart level skeletal muscles
And what is it? What can you see?
that heavily metabolize fatty acids.
Awesome. What do you see? To identify that, hey, fatty change has taken place. You would look at the lipid vacuoles which appear in the cytoplasm. All right. So that's fatty change. That can be asked. Okay, what is fatty change and all? Okay, now this part is again, we are not supposed to understand how this happens. That's the sad part. तो बस याद रखना क्या याद रखना है that these following reasons radiation, reperfusion, toxins, inflammation, chemicals, what do they cause? They cause the production of radical, sorry, yeah, you could say reactive oxygen species or radical oxygen species, right? What are those? Superoxides, hydrogen peroxides, and hydroxyl radicals. And now what do they do? They affect the cell, obviously, right? Okay. And how do we contain them? How do we contain them? We use multiple enzymes. So what is SOD, by the way? We discussed this when
Super
Naveed Bhai was reading this. Yeah.
superoxide something. It was a enzyme.
Superoxide is mutase.
Dismutase.
Yeah. So there's that. And how is hydrogen peroxide controlled? With the enzymes from the peroxisome, which are the catalase and glutathione peroxidase. Okay, so there's that. This is basically all you need to know about the oxidative species. Um, yeah, I'll test you on this in a bit. I'll let it cool down in your head. What else? So I'm sure this won't be a problem. Causes of cell injury. There are multiple ways of it happening. Just remember one or two. You will be good. So should I move on?
Yes, but do we need to remember the examples for each of the type of the cause of cell injury? Like physical agents, like these are easy, but do we have to remember the examples for all of them, like immunological reactions and the genetic
Hopefully
rearrangement?
not, because they're not in the slides. So
Yes.
hopefully not.
Okay. Yeah.
Hmm. Alrighty. So basic, when Naveed bhai was discussing the slides, I was just writing this down. So this is apoptosis versus necrosis. So in apoptosis, there's fragmentation of the cell, there's an incomplete loss of membrane integrity, and this only happens with one cell at a time, right? Necrosis is basically murder, and this happens at to multiple cells at once. It's the lysosomal enzymes which digest the cell. Okay, as we saw in the diagram in the slides. So this is basically it. So again, I'll test you on these differences. So just have a look at them. Like, all good. Oh yeah, here's the question that I was talking about: ischemia and its consequences. Right? उसके अंदर now I don't know what the Viva examiner would expect you to answer with, but if you would give it the whole hypoxia scheme, I'm sure that would be more than enough for that. So stuff like that, right? So again, this document is great. It covers well everything you would need to know. Um, so yeah, we'll discuss it soon. Next up is the types of necrosis. Now, this is an important aspect. ये आपको sadly मानना है रट्टा इसका. I wish they gave explanations to these in the class, but khair. So can anyone recall the types of necrosis? Like, has anyone studied this before? I'm sure someone has. I studied this an hour ago. So if someone else has previous knowledge, please let me know.
Necropoptosis, necroptosis.
And
There's auto something.
no. So
The regular
there's fat
necrosis.
necrosis.
Acha.
There's case, I don't know, necrosis. And there is liquefactive necrosis.
Hmm.
And there is coagulative necrosis. Now, hopefully it won't ask the details, but if it does, I'm writing one word for each, because I don't think we have the time to go through every reason. वैसे भी time short हो रहा है. So
Yeah,
this
but
is basically dystrophic calcification.
we gotta finish in 5 minutes, okay?
Yeah. So what is caseous? This is basically the cellular details going away. Okay,
Yeah,
what do you mean by that?
that cysteine uh, um, and aspartate and protease.
Proteases. Yeah. Awesome. Okay. Liquefactive is basically the death of the cell and उसके बाद जो aftermath होता है, which is the dead tissues which are part of the cytoplasm. And finally, we have coagulative, which is the most common, by the way. And its key point is that it's again a bunch of dead cells, right? और इसका जो cause जो slides के अंदर लिखा हुआ है, that is infarction. Infarction is the cause. All right. ठीक है. You know, that's about it. We have a few more things. I understand it's a very lengthy topic. There's obviously the mechanism of apoptosis. तो वो भी सर के ऊपर से ही गुजरेगा because we don't have the time for it. But inshallah, when we join at 10, अगर time बचा microbiology के बाद, then I'll go through it. If not, then,
अहमद हमारा कल
go
का
to the
स्केड्यूल
next
क्या
one.
है?
यार
पहले
देखो,
क्या
we
होगा?
are the
पहले क्या होगा
frontline
तो
सबसे
पूछा
पहले
करो।
warriors.
हमारी है।
We are the
क्या होगी?
frontline warriors. सबसे पहला हमारा वाइब है.
नहीं नहीं, वो तीन हमारे पास है ना, तीन स्टेशन, वो तीनों में क्या क्या होगा? पहले क्या होगा हमारा, दूसरा क्या होगा, तीसरा क्या होगा?
OSPI
पढ़िए
है.
बच्चे।
Like OSPI वाइब है.
टाइम टेबल खोल, टाइम टेबल खोल।
देखो, I'll tell you the timetable. So we have the Viva and then we have the simulation lab at 11 a.m. So we have an hour of self-study.
सिमुलेशन लैब क्या है?
Yeah, I asked Miss Ammon. She told me that it was basically 3D version of what we have studied. तो जैसे fetal membrane है वो पढ़ेंगे, तो उसका 3D मॉडल होगा कोई कि हर जगह से दिखेगा placenta and
मिस
the
एमन कौन सी
umbilical
वाली,
cords and
एमन
everything.
बारी या अपनी वाली एमन?
Who's Amen Bari?
मतलब अपनी वाली एमन है।
Teachers here. He's talking about हमारे वाली Amen. हमारी Amen.
I'm talking about the man. Inside joke. खैर, चले, have a lovely
Amen.
iftar.
चलो, JazakAllah khair. Inshallah,
Jazakallah.
come back 10:15 for microbiology.
Micro.
I'm looking forward to it because I haven't studied a word of that. I'm dependent on you.
System.
I'm gonna
Inshallah,
put a lot of pressure on it.
don't worry about it. We got
Jazakallah
it.
Naveed bhai. Thank you.
Hafiz.
Inshallah.
Jazakallah. Allah Hafiz.
Assalamu alaikum.
Jazakallah.
Allah Hafiz. Thank you for joining. Allah Hafiz, Naveed bhai.